zangu.
The World Health Organization has declared the Mpox outbreak a public health emergency of international concern. The Ministry of Health here in Kenya says it has implemented comprehensive screening at all ports of entry as part of a strategy to prevent the spread of the virus. Global health officials have confirmed an infection with a new strain of the Mpox virus in Sweden and linked it to the growing outbreak in Africa. Let's get a scope of Kenya's response mechanism from Public Health Permanent Secretary Mary Muthoni. Good evening, and thank you so much for speaking to us, PS Muthoni.
Good evening, Lilian, and how are you?
I'm very well, thank you. Let's talk about emergency response mechanisms and the country's level of preparedness, beginning with where the ports of entry, where screening is taking place, are at. Where are these ports of entry?
I think first and foremost, I can give you a basic background of where we started. First, we only have one confirmed case, which was gotten on the 29th of July this year. And this was a case of the 42-year-old male, Kenyan male, a long-distance truck driver. And the case was detected, isolated at Taita Taveta one-stop border shop. Now, out of that, and things have moved on very quickly. We already have strong laboratory diagnostic and genomic sequencing capacity in this country. And we have 7 of them that can be able to test Mpox in the country, starting with the KEMRI, the Primate Research Institute, the Ministry of Health Virology Referencing Lab. So all that is to ensure that the capacity can facilitate early confirmation of the outbreak to inform response. Secondly, we have a very strong disease surveillance in the across the 47 counties, and that all serves all points of entry in this country. We are capable of detecting early. And screening is ongoing as we are speaking in all points of entry. And as at 12th of August this month, a total number of 250 travelers had already been screened across the border.
Yeah, but PS, when you say the ports of entry, which specific ones? Just give us specifics of where exactly this is happening. What do the screening centers look like? Are they well equipped? You've talked about the other 7 laboratory facilities that are well equipped, but in terms of these screening centers, what do they look like, and who is manning them? Who is in charge at these particular centers?
I am getting there, Lilian. I had sequenced a lot of information. Yeah. So all these are located in the Kenya-Uganda border. These include Shimoni, Vanga, Lungalunga, Taveta, Ilasit, Namanga, Isebania, Muhurubei, Busia, Malaba, Lakwaka, and Suamu. Those are the points of entry at the border points. And what you expect in these border points are port health officers who are the Ministry of Health officers drawn from across the country. And you will find active equipment like a thermogun, you'll find thermoscanners, you'll find personal protective equipment, hand washing facilities, hand sanitizers, which are all available. Remember, this is a public health issue, and basically it can be protective. And that is why we are also promoting of the same, ensuring that we are sensitizing the masses on what they need to do to prevent of the same. Going back to our preparedness again, as I have said, we have a very well-trained multidisciplinary rapid response teams throughout the country. And we coordinate with the counties, the respective counties. For instance, after the detection of the one case, we coordinated very well with the county government of Taita Taveta, just to ensure that we have enough contact tracing and we are able to pick on the people, the suspects, wherever they are, and equally with the national administration. Again, we already have a functional public health emergency operation area, because for a case like this, we need to have a one-stop center where we have a command center, and all information should come to that command center to avoid disjointed information to the masses and making the people a bit restless. And equally, strong private sector and public-private partnership. Yeah. We already are in with our partners. They have already come on board. We've already done the first meeting with them, so that should there be any need for technical support or commodity support, then we are well equipped even before it happened. Just today, I have already inspected the Moi International Airport, where the multidisciplinary team are meeting to ensure the preparedness of the ports equally. That starts from the national administration, the taxi drivers, the hoteliers who are around there. And this is the kind of readiness that we want to see across the country. We have about 26 staffed points of entry out of the 35 that are gazetted in this country. And out of the 35, 12 are considered to be at high risk of importation of cases from Mpox affected areas. And those are the border points that I talked about, Lunga, Taveta, Ilasit, Namanga, Isania, you know.
And then, talking about, PS, talking about, let me just come in right there. In terms of the East African community, and of course, discussions around, the ports of entry, what discussions are you having with neighboring countries that border Kenya in terms of prevention and protection, as well as ensuring that indeed the virus does not get into the country or leave the country if at all there happens to be a threat? What coordination is there between the East African countries, the East African community as regards this current situation?
So, Lillian, currently, as we are speaking, the cross-border informal information sharing exists between Kenya, Uganda, and Tanzania, and the neighboring countries. And efforts are underway to establish formal cross-border data and information sharing between Kenya, Tanzania, following the signing of MOUs between the Ministries of Health between Kenya and Tanzania. So this is work ongoing, and maybe we should not preempt, because as we continue, things are moving really fast. As you have seen, even our boss has released a press statement this afternoon, and we will continue giving information as it comes and as it flows.
Right. And let's talk about the new variant, the deadly variant that now, also poses another new threat and dimension. What do we know of it so far? And what can you tell us as a ministry as regards this new variant?
Well, going by the information which we have on the desk, the new variant of Mpox, which is referred to as Clade B, 1B, has been found to be very highly virulent and able to spread from one person to the other more easily than other previous forms. Remember, Mpox started all the way in 2022 in some other countries. So the mortality rates, again, could be very high as 10% of those infected. And that is why we need to be more careful. And as we continue, we will give more epidemiological details from the experts so that we are able to understand deeply on what this means.
We thank you so much for your time, PS Mary Muthoni, Public Health Permanent Secretary, talking to us a day after the World Health Organization and the Africa Center for Disease Control declared Mpox a public health emergency.
Alinian, before you go off, I think it's an appeal for me to the media that they will help us with risk communication. information that should be disseminated to the people at the bottom of the pyramid so that they know what really they need to do. And especially people like you who are on TV, when we hear information, kind of relate to them, to Kenyans.
We thank you, Waziri. We will do our very best, and we thank you so much for your time. Many thanks.
Thank you.